Hello again. So I'm doing a video. I'm at the 3-month mark of my cranial cervical fusion. So I thought I'd make a video because 3 months means that I can start to wean or use my collar less and less. So here she is in all her glory. There's a cat scratching. Got new padding because it did get gross. Only so many times you can clean the padding of a Vista collar before you have to just get replacement pads, which are on Amazon for only $16, so it's really not that big a deal. So I had my first physical therapy session yesterday. I'm back to work 8-hour shifts 3 times a week. I'm still on a restriction with patient care. I cannot be technically left alone with patients because they might fall on me and break my neck. So to protect the hospital and myself, we have a contract that I am just to limit my time with patients, which is very difficult for me, but I am discharging them and teaching them discharge instructions and doing my thing. Anyway, that's work, so I'm happy to be back to work, sort of, and I am feeling good. It feels good to get the collar off. It was pushing on my scalp a little bit more than I would like, and it was causing the nerve pain, which I'm having quite a bit of neuralgia pain to my scalp because all of the nerve endings are trying to wake up and recover. So the collar off helps, I think, with the headaches. I'm doing some strengthening exercises to my back, shoulder shrugs, traction, working on getting my movement back, as you can see. Look at that. That's just the first day of PT. And I got that going for me. Up, down. I guess you're supposed to get about 45% of your rotation back. And you're supposed to get most of your up and down. You just use a little bit more of arching of your back when you look up, but I should get most of that back. So far I'm pretty hopeful that these 2 surgeries worked. I feel good. You know, some days are painful and sore, and some days I have to be in bed a little bit more, but that's pretty typical, I think, of just the surgery I had. It just takes a long time to get those muscles back, and now that I'm working them, they're going to be more sore, so that's what to expect. I'm hoping after 2 weeks of PT that I could go back almost full-time, maybe on restrictions still. I would like that, but see how it goes. I will have the MRI and CT scan done in 6 months because everything is going good. That will be February 2020 when I'll find out officially if the surgeries have worked. It's the first time I'll get to see the hardware and see how it's placed. I can do that in my own state, I hope. I'm just gonna have them send the order for the MRI and CT here to my hospital, and then have them sent to New York. I don't see any reason to go back to New York at this point. I keep in pretty close contact with Dr. B through email. I update him. He doesn't really respond, but he doesn't say anything back. So I assume he's pretty happy with my post-op stuff. Communicate my restrictions every 2 weeks to Irene, who's the executive assistant to Dr. B. I'm hoping to reduce the use of my collar. In general, I feel pretty good. I still feel like a tired mom, but probably works too much. And I probably am still anemic from surgery because I get tired sometimes, so I'm trying to eat well. Just want to fast forward. Christmas, but I would like to, know if the surgery was successful sooner rather than later, because waiting is again difficult, and I'd like to lift all my restrictions, but technically speaking, I don't know if anything's really worked or that everything is sound until February, but I don't tell them that. I just keep on doing 2 weeks of restrictions at a time and hoping I can just slowly progress into my role as a nurse, which I love doing, which I'm not going to stop doing for hopefully a long time now. A lot of people ask about the headaches. Still have the headaches, but they're more manageable. Still don't have those building headaches. Those are completely gone. The dizziness is much better. I did have a little bit of dizziness and vertigo maybe about a month back. But I got over that. That feels better now. I still have trouble with my POTS, my posterior orthostatic tachycardia syndrome. My heart rate likes to go all crazy on me when I do activity, which I probably should look into down the road. I guess if I see a genetic specialist in EDS, a connective tissue disorder, he can hook me up with the testing to get tested for POTS officially. So my PT has some connections, because I did get one of the best physical therapists at the hospital here. She has worked with people with EDS. She has worked with people with Chiari, and she's worked with people with fusions. So she's never had all three, so I've combined them for her, but she's very knowledgeable. So I'm hoping she can help me get in to see a connective tissue specialist, because I do have quite a bit of joint pain and hip pain and knee pain, just general soreness, and I'm assuming that's because my ligaments are laxer than most. So best to get ahead of that to see what's gonna fall apart next in the future. Hopefully it's not my neck, now that my neck is fixed. Well, hopefully. Alright, I'll keep you updated. I probably won't post until the MRI, unless something happens in February. Otherwise, I feel like I'm in a good spot. I feel like I'm not gonna die every night. I sleep much better. Yeah, doing good. So, do believe Dr. B saved my life. I'm not gonna tell him that, because it'll go straight to his head, but I think he did. Bye-bye.